Sciatica is a word that can strike fear into anyone who has experienced its sharp, radiating pain, often described as shooting, burning, or tingling, traveling from the lower back or buttocks all the way down the leg. But what is sciatica really? And more importantly, what can you do to manage it safely and effectively, especially if your pain originates in the lower back? Understanding the causes, the anatomy involved, and the body's own healing mechanisms is the first step to finding relief. Let's explore how you can work with your body, rather than against it, and discover 4 simple poses that may help you on your journey to recovery. To start, it's important to understand what sciatica actually is. Sciatica is not a condition in itself, but a symptom, a sign that something is irritating the sciatic nerve, the longest and largest nerve in your body. This nerve begins in your lower spine, specifically from nerve roots in the lumbar region, and travels down through your buttocks, the back of your thigh, and all the way to your foot. When something compresses or irritates the nerve roots, most commonly a herniated disc, bone spur, or narrowing of the spine, spinal stenosis, it can trigger pain, numbness, or weakness anywhere along the nerve's path. The pain often starts in the lower back or buttocks, and radiates downward, sometimes as far as the toes. For some, it's a dull ache. For others, it's a sharp electric jolt. The discomfort can be constant or intermittent, mild or severe. It can make everyday activities like walking, sitting, or even lying down challenging. But knowing what's happening inside your body can help you make better choices for healing. Let's take a closer look at the anatomy. The sciatic nerve is formed by the merging of several nerve roots that exit the spine in the lower back. These roots bundle together to create a thick, cable-like nerve that runs deep in your pelvis, through your gluteal muscles, and down the back of your leg. Because the nerve is so long and serves such a large area, irritation at its source can cause symptoms far from the site of the problem. That's why pain can travel all the way to your calf or foot, even if the issue is in your lower back. When a disc in your lumbar spine bulges or herniates, it can press against these nerve roots, setting off the cascade of pain and inflammation known as sciatica. Sometimes other structures, like bone spurs or tight muscles, can also be culprits. Whatever the cause, the result is the same. The nerve becomes inflamed and sends pain signals along its length. But here's the good news. Your body is equipped with a remarkable self-healing process. When tissues are injured or compressed, your immune system springs into action. Inflammation is a key part of this process. Special immune cells called macrophages are dispatched to the site of injury. Their job is to clear away damaged tissue and help start the repair process. While inflammation can cause swelling and discomfort, it's also a sign that your body is working to heal itself. This is why it's important not to immediately suppress inflammation with medications or interventions unless absolutely necessary. The healing process needs time to unfold. However, that doesn't mean you should simply rest and avoid all movement. In fact, gentle movement is one of the best ways to support healing and reduce pain over the long term. Why is movement so important? When you move, you increase blood flow to the affected area, delivering oxygen and nutrients that your tissues need to repair themselves. Movement also helps to keep your muscles flexible and strong, which can prevent future injuries and speed up recovery. Gentle, controlled movement encourages your brain to turn down the volume on pain signals, helping you feel better and regain confidence in your body. But not all movement is created equal. The key is to find exercises and poses that gently mobilize your spine and hips without putting too much strain on your lower back or aggravating your symptoms. If you push too hard, you risk making the problem worse. If you avoid movement altogether, you may prolong your recovery. The sweet spot is gentle, mindful activity that feels good and never increases your pain. With that in mind, here are 4 simple poses and movements that can help you manage sciatica, especially when it originates in the lower back. Remember, if any movement causes sharp or increasing pain, stop and consult a healthcare professional. First, Let's talk about walking. It may sound simple, but walking is one of the most effective ways to encourage healing in your lower back and sciatic nerve. When you walk, you gently mobilize your spine, engage your core muscles, and promote circulation throughout your body. Start with short, slow walks, just a few minutes at a time if that's all you can manage. Gradually increase your distance and pace as your symptoms improve. Focus on walking with good posture. Keep your head up, shoulders relaxed, and core gently engaged. If you notice your pain worsening, take a break and try again later. Next, consider the crawling movement. Crawling may seem childlike, but it's a powerful way to engage your entire body while keeping your spine in a safe, neutral position. Get down on your hands and knees, with your wrists under your shoulders and your knees under your hips. Gently crawl forward, moving opposite hand and knee together, then switch sides. This cross-body movement activates your core and improves coordination, while taking pressure off your lower back. If you're not comfortable on your hands and knees, you can modify the movement by staying closer to the floor and moving slowly. The goal is to keep your spine long and relaxed as you move. One of the most effective poses for core stability and lower back support is the bird dog pose. Start on your hands and knees, just as you did for crawling. Engage your abdominal muscles gently to stabilize your spine. Slowly extend your right arm forward and your left leg back, keeping your hips level and your back flat. Hold for a few seconds, then return to the starting position. Repeat on the other side, extending your left arm and right leg. Move slowly and with control, focusing on keeping your movements smooth and steady. This pose helps to strengthen the muscles that support your spine and pelvis, reducing pressure on the sciatic nerve. Twisting can also be beneficial, as long as you do it gently and within your comfort zone. Twisting helps to mobilize your spine and hips, releasing tension in the muscles that can contribute to sciatic pain. While lying on your back with your knees bent and feet flat on the floor, gently let both knees fall to one side, keeping your shoulders relaxed on the ground. Hold for a few breaths, then bring your knees back to center and repeat on the other side. Only go as far as feels comfortable. Never force the twist or push into pain. This gentle spinal rotation can help relieve pressure and improve mobility. Finally, consider a chair-assisted variation of downward-facing dog. This pose provides a gentle stretch for your spine, hamstrings, and calves, without putting too much strain on your lower back. Stand facing a sturdy chair and place your hands on the backrest. Step back until your arms are straight and your body forms an L shape. Keep your feet hip-width apart and your knees slightly bent. Let your head relax between your arms and feel a gentle stretch along your back and legs. Hold for a few breaths, then slowly walk forward to come out of the pose. This variation allows you to enjoy the benefits of a classic yoga pose while minimizing stress on your spine. As you try these movements, it's important to listen to your body. Avoid any exercise or position that increases your pain, especially if it causes sharp shooting sensations. The goal is to find movements that feel good and support your recovery, not to push through discomfort. If you notice that your symptoms worsen after a particular activity, take a step back and try something gentler. It's also crucial to respect your body's natural healing process. Inflammation, as uncomfortable as it may be, is a sign that your immune system is working to repair damaged tissues. While it's tempting to reach for anti-inflammatory medications or ice packs at the first sign of pain, these interventions can sometimes slow down the healing process if used too aggressively. Instead, focus on supporting your body with gentle movement, good nutrition, and plenty of rest. If your pain is severe, persistent, or accompanied by other symptoms, such as numbness or weakness in your leg, difficulty controlling your bladder or bowels, or sudden severe pain, seek medical attention right away. These could be signs of a more serious condition that requires prompt treatment. For most people, however, sciatica improves with time, patience, and the right approach to movement. By understanding the anatomy of the sciatic nerve, respecting your body's healing process, and incorporating gentle, targeted exercises, you can take an active role in your recovery. Let's recap the key points. Sciatica is a symptom, not a disease, usually caused by compression or irritation of the sciatic nerve roots in the lower back. The pain can radiate from your lower back or buttocks down the back of your leg, sometimes reaching your foot. The sciatic nerve is the longest nerve in your body, serving a vast area from your lumbar spine to your toes. When a disc or other structure compresses the nerve roots, it can trigger pain, numbness, or weakness along the nerve's path. Your body's natural healing process involves inflammation and the action of immune cells like macrophages, which clear away damaged tissue and promote repair. While inflammation can be uncomfortable, it's a necessary part of healing. Movement is essential for recovery, as it increases blood flow, delivers nutrients to injured tissues, and helps your brain process pain signals more effectively. The key is to choose gentle, controlled movements that don't worsen your symptoms. The 4 simple poses and exercises that can help manage sciatica are: 1. Walking. Gentle, regular walks with good posture can mobilize your spine and promote healing. 2. Crawling. Moving on hands and knees activates your core and improves coordination, without stressing your lower back. 3. Bird dog pose. This exercise strengthens the muscles that support your spine and pelvis, reducing pressure on the sciatic nerve. 4. Gentle twisting. Controlled spinal rotation can relieve tension and improve mobility as long as you stay within your comfort zone. Additionally, a chair-assisted downward-facing dog variation provides a gentle stretch for your back and legs, helping to release tension and support recovery. As you incorporate these movements into your routine, remember to listen to your body. Never push through sharp or increasing pain. If a particular exercise doesn't feel right, modify it or try something else. The goal is to support your body's healing, not to force progress. Finally, be patient with yourself. Sciatica can be frustrating and slow to resolve, but with the right approach, most people find relief over time. Support your recovery with gentle movement, good nutrition, and adequate rest. If you have any doubts or your symptoms worsen, don't hesitate to consult a healthcare professional. By understanding the nature of sciatica, respecting your body's healing process, and practicing safe, effective movements, you can take charge of your recovery and get back to doing the things you love. Remember, healing is a journey, and every step you take, no matter how small, brings you closer to relief.